very difficult situation. We are in dire condition. The country's health system devastated. We in Odia Samaj thought that why can't we join hands with like-minded Odia doctors spread across NCR and if possible the whole country and outside the country. Dr. Ashok Chaudhary, eminent doctor in Delhi, came forward with a proposal. He said, sir, why can't we join hands together, Odia Samaj, under the banner Odia Samaj? We start giving, we may not help them in hospital administration or in admitting patients in hospitals, but we could think about a novel way of telemedicine. We could help them by giving free consultancy. We could also think of wellness. We could think how best to alleviate their suffering at this time of need. We thought among ourselves that Odia Samaj, our aim is to serve the society at large. Last year, during the time of lockdown, we had supported about 15,000 Odia families in the NCR region by giving them food packets for about 1.5 months. This was very well appreciated. And we thought that in this time, when the whole health system has sort of collapsed or on the verge of collapsing, we thought that we should all join hands with the Odiyas, non-Odiyas, any Indian. After all, we are first Indian, then we have sub-nationalism. We thought that we could think of medical consultancy through telemedicine. We could think about nutrition guidance, traditional and modern medicines, and also other facilities which could help a patient to come out of COVID. In this regard, we thought that no better person than Satyendra Mishra, the chief executive of Amrita Hospital, who are setting up a 2,000-bed hospital in Faridabad. He is not only a fellow Odia, but a very compassionate Odia who goes out of the way to help people at time of needs. He has been a very, very senior bureaucrat in government India for well over 40-45 years. Mr. Mishra, after retirement, became the Chief Information Commissioner of Government India, rank of a Supreme Court judge. Mr. Mishra was very kind enough to say that, yes, I will participate in this thing and give whatever advice, though I'm not an expert. I informed him that, sir, we are not experts, but we are galvanizing the force, the Odia force, be it civil servants, doctors, anybody who can help give succor to the people who are suffering from COVID. We have an expert, international expert, a world-renowned gastroenterologist, Dr. Subrat Acharya. Dr. Subrat Acharya has been a professor in the premier medical institute of the country, the All India Institute of Medical Sciences. Now he's the Vice Chancellor, Pro-Vice Chancellor of KITS University and also President of the All India Institute of Medical Sciences, Bhubaneswar. Beside, he's an advisor to many hospitals in the country. Dr. Acharya will be speaking his mind about the problem we are facing in this very, very difficult time. We have Rahul Kola, who is the CEO of Viveo, and he'll be speaking how technology can reduce the gap in telemedicine success. He is an international renowned person in these aspects, though his company is based in Estonia, but today he's in Spain and probably he's expanding his operation to other parts of Europe. We have Dr. Ashok Chaudhary, again a very renowned young doctor in Delhi. This was his brainchild to start with Prasant Mahanti, the country head of Viveo, that under the banner of Odia Samaj, we could all join together and bring some solution to the problem which the country is facing. The country is not only facing, it is on the verge of collapsing. Yesterday, this morning, we had 332,000 infection If this goes on in next 3 days, we'll cross 1 million patient infected in COVID. It is a world record. 1 million 3 days, no country in the world, never it has happened in history, not during the Spanish flu. God knows what is at store for us, for the country, but I will only pray that all of us are safe, so that we give a lending hand to our telemedicine project, so that it goes ahead and it helps people to save themselves, and also not only that, they will be getting relief from this deadly virus. With these words, I'll request Satyendra Mr. Sahib to speak his mind and give us his guidance. Thanking you all.
Thank you so much, Siddharth, Sandeep Babu, Dr. Acharya, and others present in the meeting today. When Siddharth asked me to participate, I said that if Dr. Subrat Acharya was there, then he is the person who should be really inaugurating this. He is not only one of the most eminent physicians of the country. Government of India conferred, President of India conferred Padma Shri on him a few years back because of his eminence as not only a physician but also as a research scholar. So with him present in this, I think we are very privileged to have him here. We'll have his views. So, and I'm very happy to know that you have also tied up with the Estonian company to take this initiative forward. I'll say a few words about what I have been witnessing about the activities of Odia Samaj. With Siddhartha at the helm of affairs in the Odia Samaj in the last 5 years, they have been so active. I mean, not a month goes by when they are not doing something, either for the betterment of Odias as a community, but also as for Indians at large, cultural, social, economic. So they keep coming out with one or the other initiative. Recently, the release of the Hindi translation of Dr. Harikrishna Mahatab's History of Odisha was one such initiative where Odia Samaj played a very important role. I congratulate Siddhartha and his colleagues in the management of Odia Samaj for taking these initiatives. Dr. Acharya, of course, will speak more, much more on relevant things about how through a telemedicine platform any help could be extended to COVID patients. But the little that I know about telemedicine has been by and large very effective when it has been a paid platform. Years back, when I was associated with SIDBI, the bank, SIDBI had funded a promoter who set up way back in 2010-11 a telemedicine platform, which in 2-3 years time had more than 50 lakh annual inquiries. They were charging a certain amount of money for consultation, and the doctors had an incentive, because if they would get for each consultation, which would last for about 10 minutes or 15 minutes, they would be paid a certain amount of money. That money was being shared between the doctor, the telephone operator who hosted that conversation, and of course the company which set up the platform. I would suppose that this Estonian company Viveo might be also following a similar kind of financial model. If the Odia Samaj initiative is entirely a voluntary and free pro bono kind of a service, one has to be very careful that if anybody calls up and a doctor doesn't pick up that phone or doesn't pays not very serious attention to a request, then the initiative will get a bad name. So therefore, while launching it and while enrolling doctors for this initiative, it should be made very clear to the volunteer doctor that he should agree to be a part of it only if he would find time, because I can't imagine which doctor would have really spare time these days to engage in a conversation with somebody and offer some advice. Number two, for very ordinary kind of ailments like a headache or fever or something, or a sprain in the ankle or something, some oral advice could be given without fear of any backlash. I mean, because if a doctor gives an advice and if that leads to, because this conversation is recorded, this can be recorded, and if some patient makes a query and a doctor gives an advice, and if that on the basis of that advice, if something not so good happens to that patient, then there could be, of course, in India, I mean, we don't take doctors to court very often, but surely abroad people take doctors to court. So therefore, doctors are heavily insured. So in this case also, this second side Siddharth, will have to be taken care of. Dr. Acharya will be able to guide us more in this matter. But so this is the second one. As such, telemedicine is the future of medicine, because some year and a half back, just before the COVID, I was reading an article in New Yorker magazine, which said that the future of medicine would be looking like the control room of an airport, where there would be whole range of electronic consoles before whom doctors should be sitting, patients should be in their homes, and nearly all the treatment would be done more or less at home. I mean, a situation which has arisen now by force. I mean, many doctors are advising people. I keep getting WhatsApp messages, like you must be getting WhatsApp messages, that you don't need to go to a hospital. You should be treated. You should look after yourself at home. And the doctor, in the extreme case, the doctor might be summoned. Otherwise, you take care of yourself. I will, before I end my, my whatever I have to say, I would say one thing, that one of the reasons Dr. Acharya and the other doctor friends in this gathering might not agree with me, that one of the reasons that why we have come to a situation of such unusual dependency on doctors is because over the years an impression has been created in the world that people are not more, they don't have to die. I mean, there is no condition in which the doctors want to tell you that it could be repaired or it could be cured. Or so even when we are facing with a pandemic of this dimension, everybody thinks that he should get complete medical care, he should get oxygen for his asking, he should nothing should happen to him. How can even God cannot make this kind of if there is a God, even God cannot make this kind of an assurance. Human beings are mortal, they will have to die, they will have to die of either a disease or by sheer passage of time. So giving this kind of an impression, I recall that some 50 years back or 60 years back in Kotak, when I saw a film in Bengali. In that film, an Ayurvedic doctor's son becomes a MBBS doctor. So when he returns home, he finds that his father or grandfather, I'm not able to recall correctly, tells the patients on their face that they would have little chance. The disease has advanced so much that they should now be looking to their end. So the son said that, Grandpa, why are you being so blunt? Why are you telling the people like this? Then he said that like birth, death is a certainty. I mean, even if you tell a person that he is not going to die, of course he will die. So therefore, he is preparing people to confront the truth. So this I said, in not somewhat so seriously, because Dr. Acharya will surely contradict me. But I would appeal that if this initiative has been taken by the Odia Samaj, let us all get together. The most important role will be, of course, the doctors who would volunteer. I would request that during this period, as long as this platform is active, the modalities, the number of the telephone numbers where people would call, how will they be routed to a doctor? Because if there are 1,000 doctors, of course, 1,000 telephone numbers cannot be circulated to people. I don't know how does it happen. Is there a central platform, control room through which these calls will be directed to the doctors? I do not know, because it requires some amount of very fine tuning. Maybe Viveo, since it's a professional setup, they might help you in doing that. I wish all the best, and I feel privileged to be part of a gathering where Dr. Subrata Acharya is also present. Thank you, Siddharth, and thank you, Sandeep Babu, for hosting and anchoring this program. Thank you so much.
Many thanks, sir, for your speech and the issues that you have flagged. And through this platform, we would like to assure everyone who have joined and the doctor friends who have volunteered, they have also joined, that our endeavor is going to provide the best professional services possible in the best professional and medicinal manner. And we'll try to keep up the flag of Odia Samaj high by ensuring that our doctor friends who have joined hands with us will do justice to their role for which they have joined hands with us. With these words, I would request Padma Shri Dr. Subrata Acharya to speak on the issue of the role of healthcare professional in this pandemic time. Over to Dr. Acharya.
Thank you, sir. Thank you, Sandeep. And at the outset, friends, ladies and gentlemen, I must congratulate 3 organizations and few individuals for this brilliant endeavor at a time when we needed it most. The first organization is Odia Samaj, which is headed by Mr. Pradhan. And as Satyananda Babu has already praised him and has already enumerated their activity and dynamism to help people all around. And the Viveo, the technology platform, with Prasant Mohanty as his country head, and the CEO, Mr. Kallo from Spain, and thirdly, Professor Ashok Chaudhary, who has been always on the forefront of connecting all areas globally and trying to transmit the possible benefit technology and medicine has achieved till date to all around. And I must convey my deep appreciation and heartfelt obligation actually for this wonderful job. Well, friends, it is needless to say that we are in a time which is unprecedented, because it is like a war time, just like it's like we never have seen a third world war, but we are seeing what is like a third world war, because here millions of people are dying. Mr. Mishra told that death is a certainty. Yes, it is a certainty. But sir, premature death in young people, in pediatric age group, in people who had comorbidity, I agree, who would have a survival of another 15 to 20 years, losing life and losing life very quickly is obviously a pain to the family and also shortcoming to our understanding of the disease. We have seen during last 1 year, this virus, that is SARS-CoV-19 virus, has actually taught us many things, but also has eluded us. Well, you have seen during this last 1 year, the virus has changed. From a very first mutant virus, it is an animal virus. It mutated, it changed itself, to get into human lungs and use its receptor present in the lungs, right? It was not there in its surrounding proteins, which are called spike protein, you must have heard. It is mutated and got into human lungs.
Okay.
And as your immune system chased it, it understood it. It replicated rapidly, and now it has various forms. And it is various form have created us problems in diagnosis because available wild type to diagnose the so-called RT-PCR you have heard to diagnose wild type of PCR cannot diagnose this various form of mutant. So we are now seeing that even with negativity, you have this COVID infections. Third change you have seen, it is rapidly spreading. Fourth thing you have seen, in contrast to last March, the pediatric population is getting affected. And since it is rapidly spreading, whatever may be the reason, maybe because of the virus, maybe because of our logistic strategies which failed, maybe our anticipation and modeling, epidemiologic modeling predicting the future disease course, maybe whatever may be, or maybe the combination of reason, it has a severe second surge. And the severe second surge has clearly indicated one thing. It is spreading like fire. Now this has happened in UK and USA. And in the meantime, two things has happened. You have understood that it is a multisystemic disease. And second thing, you have vaccine. The recent data shows the vaccine indeed protects, and less than 0.05% has breakthrough infections. So one of the important parameters to prevention you have, and that is the vaccine strategy, combining other things. Also, you have understood that available antivirals for which is being black marketed are actually not effective. You have understood that. So the recent treatment strategy and prevention strategy and control strategy, in fact, is dynamic and changing every day. And I take this opportunity to invite Dr. Chaudhary and Prasant and Sandeep to create a platform to provide this dynamic change in information, almost a weekly platform to people. What additional information has come? What is new in it which will help them in prevention, in diagnosis, and in therapy? For example, Ashok, you know today, the budesonide inhaler in randomized controlled trial is the mainstay of therapy. Many people are running after remdesivir or favipiravir, which is not evidence-based. You understand? Simple giving a budesonide inhaler from the very beginning, 800 microgram twice daily, which is preventing serious infection. This one thing, right? Awake prone respiration. You can make a video and show it, which increases the saturation. Third thing, since it is a telemedicine group, now we know a diabetic develops COVID, his blood sugar goes haywire because there are ACE receptor for COVID in pancreas. Now a cardiac patient develops COVID. Now he is in problem of thromboembolism. Now you know enoxaparin is the drug of choice. Now a patient who has cancer, who has COVID, he has a different problem. Now you are a hepatologist yourself. You know decompense cirrhotics, if develop COVID, has problems. Now who treats them? A general physician? You have a platform to create specialist group for COVID with heart disease, COVID for pediatric people, COVID for diabetes, COVID for kidney failure, COVID for multiple comorbidities. And you have groups to join this specialist group to convey, this is what I'm seeing actually. And this is what I'm facing myself. And I get every day 30 to 40 calls just to understand what they will do. It's very unfortunate that the help is limited. Fourth thing we have already understood. I will not blame anybody, neither Dr. Pradhan, Pradhan or not Misra, they had been our rulers. We have not created infrastructure for health in this country. We have never invested in health infrastructure. Now, 70 years we have never invested, whoever may be in the scenario. Now, suddenly within 1 year, how can you jack up the infrastructure? Our infrastructure in health has not collapsed. It was from the very beginning inadequate. It was inadequate for existing disease and patients. If you come to public sector hospital like AIMS, even Dr. Chowdhury's place, ILBS, even it is, some fees are there, it is overload. They are not doing justice, I will say. He will be seeing in OPD 300 patients in 3 hours. How can you do justice? So our infrastructure we have not built up. It has not collapsed. It was inadequate from the beginning, and it has become much more inadequate now. No, I agree on the fourth thing, as Mr. Misra pointed out, technology has assisted us. Now, telemedicine platform is a technology which has an outreach, large outreach. You can reach multiple people and from far off place with little support. Now, suppose for at present, we need to take care of COVID. Now, most of the fevers today, if you analyze, take 100 patients of fever, 98 are because of COVID. 2 may be because of different reasons. So even if you don't do a test and give them a treatment of COVID, you will be wrong 2% of time. 98% of time you will be right. Second, 98% of these patients are mild to moderate patients which can be easily treated with simple measure, as I had suggested initially, who needs assurance, not panic. Third thing, their mental health. The panicness is creating problem. So they need this mental assurance and help. And fourth thing, what specific diagnosis? Because if you know now what is happening all over, a strip of 10 favipiravir which used to cost 1,200 rupees, now being sold at 15,000, which has no effect. Remdesivir is being sold with 40,000, a vial of 100 micrograms. The oxygen cylinder is costing 2.5 lakhs, 10 liter cylinder. Oxygen concentrators are out of market. Now, under that circumstances, this is a tremendous platform to help people, to get them simple measures, how to improve their oxygenation, how to treat these patients with simple medicines, and what exact investigations to be done. Kudos to you, Ashok, and Odia Samaj and others who have created this. Fourth thing, I must also congratulate or appreciate Viveo technology who have come forward to assist this large people who are suffering at this moment, who needed actually hand-holding. We need it. And I will say thank you very much. There are hundreds of things to speak on COVID. I don't think I will take your time. I think I will thank the Odia Samaj and other people to have asked me to be present in this wonderful endeavor. And I must promise you, I'm there to help you, to assist you, right, for all the times to come till we control. But I will tell you also, don't stop this platform even after COVID have subsided. COVID will subside. Because if your herd immunity is 60 to 70%, which can be done by vaccine as well as natural, which has happened in the UK. If you see the UK model, it has stabilized. And it is gradually coming out. And their survey shows it is actually 70% of the population have antibody now. And we know if you have antibody, the breakthrough infection is small. So maybe the third surge will be there, but it will be a small surge. And maybe another 2 months or so, this present epidemic will subside. But in 2 months' time, don't stop the telemedicine platform, because you know, now the telemedicine platform is needed for millions of people all around to get simple advice. Thank you very much. And telemedicine may be a part of Odia Samaj's daily activity, and with Mr. Pradhan as a dynamic president of it, and with Mr. Misra with him, who is quite influential all around, I think this telemedicine platform will long live to help millions of suffering humanity. Thank you very much.
Many, many thanks, sir. In a very short span of time, you have shared your thoughts, you have shared your experience about how COVID has unraveled in the last about a year, and how it has, from a disease which was not known in the earlier days, has become the dreaded disease in today's time. So, and thanks for your suggestions, and we are sure that in the days to come, Odia Samaj and Viveo Health will be reaching out to you for your expert advice on various issues. And we are very grateful, sir, that you took time out and shared your thoughts with us. I would now like to request Mr. Raul Callo, who would be talking about the role of technology in COVID care and precisely how Viveo is going to help in this kind of situation where telemedicine, partnering with Odia Samaj, will be reaching out to nook and crannies of the countries. Over to Callo, Mr. Callo.
So, first of all, thank you very much for having me, and so happy to create this partnership with you. So, if we talk about Viveo Health, then we have one main goal, and then the goal is to help 1 billion people in the world. And for that, we need a lot of partners. We know that that healthcare systems are broken, inefficient, and then not customer-centric and not even a doctor-centric. There are a lot of things that are happening like physically on the paper, and that is something that makes it very, very difficult for the doctors to even give second advice. But we saw a little bit more than a year ago that 77% of the world population wanted to turn their doctor visits from offline to online. And now it's even more relevant, seeing these big numbers of COVID infections and this spike. It's super clear that the most efficient way to turn the tide in COVID-19 is through the telemedicine. This is the information that I'm, as one of the health technology members in McKinsey Global Health Tech Leaders Roundtable, got from them. And yes, together with a lot of partnerships with doctors, with companies, we do believe that we help 1 billion people by 2025. And what do we need for that? We need a lot of doctors to give even only one digital consultations a day. If it's 600,000 doctors in next 5 years, giving one digital visits per day, then we will end up having 1 billion of doctor visits. So about a year ago, our platform went live. In 2 days' time, we got doctors from 42 countries who signed up to our technology. So what we noticed was that we can make it better. And then we created a platform that is most simple and easy to use, not only for the doctors, but also for the patients. Meaning that doctor can take their offline practice online. They can write prescriptions. They can do e-health records. They can even send to the pharmacies and collect payments, all in our platform. And then if doctor initiates a call with a patient, then it's the most simple platform on the planet. And for the patient as well, patient can first of all create a digital health record, can contact with you, and can have opportunity to video call, to chat, to take a normal call, and always do the payments, get prescriptions, everything. So what is the uniqueness of our platform? It is the fastest, so that if you go and onboard yourself, it's 20 times faster than all the competitors. I think it's super critical that it's simple for you and easy to use as well. So, and of course, for us, I think health data is something that is absolutely critical, that it's secure. Because imagine if someone has access to patients, health data and changes the blood group, for example. So it can cause the death of your patient. So that's why we are following all the highest standards. It's HIPAA, GDPR, PCI. We have medical device certificate for that, so that you can be sure your patient data is handled safely. And what is Viveo Care for COVID? So we have created a digital symptom checker, so that will help you to get to the faster decisions. You can monitor your patients if you want follow-up vaccination process, and also, if needed, we can create a digital passport for vaccinations. So I think to overcome through these difficult times, we need to cooperate, together with you, together with the doctors. And if we provide the technology that enables to save your time, to not only time but be safe, because you don't. Last thing that we would like to have is COVID sick doctor, because we need a lot of doctors. We need them to be safe and help a lot of people. So from our side, this platform for you is available. It keeps these sick patients at home, away from you as well. And of course, it's reducing infection to get from one person to another. So this is very, very simply that what we have created. So I was in India in January and February, and really loved it there. And it's so sad to see how the COVID numbers are increasing there again. And then let's fight it together. From our side, we can guarantee that you have the best platform. We develop it heavily. We build partnerships with MasterCard, partnerships with Bill and Melinda Gates Foundation, so that you could get always the best technology for your practices. And exactly, you don't need to go to your offline places. You can start servicing your patients from your own home. We have created a virtual office for you, so you can use it and definitely can benefit out of this. So what we have seen globally, that the increase in digital visits is going from most digitalized hospital chain in the world. They did 5 years ago only 3,000 digital visits. Now it's more than half a million. So I think it helps you to save a lot of time and to service much more patients in the future. And also you have so much better overview about the patient data that you had previously. So thank you. We are super grateful, and I think it will be a super good cooperation together with you.
Many thanks, Rolf. We reciprocate your gesture, and we are also at Odia Samaj grateful that you have, in a timely manner, you have provided this telemedicine platform to us. It all started just a week or 4 or 5 days back, and with your help and with the help of the volunteers, we have been able to set up this platform. And as you have rightly pointed out, in today's time, telemedicine is the thing to look for. And Dr. Acharya also mentioned a very relevant aspect of mental health. So what we are proposing to do is, apart from the telemedicine platform that we are launching today, from tomorrow onwards, we'll be also hosting well-being programs, where we'll be inviting well-known yoga expert and such people who can talk about the mental well-being of patients in general. And also in particular, they'll be talking about all those who are not affected, but are getting affected in some manner, and stress is being caused to them. So that is also another aspect which will be built into this entire program. And moving forward, I'd like to invite Dr. Ashok Chaudhary, who is the motivator, prime motivator to say, or mover of this program. It was about a week back that we spoke about how to start this program. And now within a week, we have been able to launch this program today. And you would be talking in detail as to how this program will work out, how this telemedicine platform will work in reality, and maybe what Satyanand ji pointed out regarding certain issues about the professional conducts of doctors and other things, and the advice that would be given would be also addressed by Dr. Ashok Chaudhary. I request Dr. Chaudhary to talk about the issues that we'll be taking up through this telemedicine initiative. Dr. Chaudhary.
Thank you, everyone. And thanks, Mr. Sir, for his like a senior in member in our family who usually wants to safeguard. He has given strict tasks that how you are going to monitor the quality. That is the first thing we'll assure to sir. Second, it is all time I mentor my teacher and respected Acharya sir, who has if he is there, then I'll be most comfortable, and that's why I think more comfortable to this program. And obviously, Siddharth sir needs no introduction, and no, I cannot say my happiness when I told sir we do want to something. He's the only person. Do it also now, today, and this is how the things has moved, as rightly said by the Mr. Sandeep. So what we can say, first I will answer the question. Sir has told how it's the time. So definitely we know doctors all are stressed, all are having working beyond these limitations. But we can see that we are here, a group of passionate doctors, one. Two, I can say the time management. I can say with this time, nearly every day we are using our 2 to 3 hours per day for the gadgets, which is not giving anything rewarding, which is gossiping, seeing the news and all the things. And I request my colleagues are here, they can think that if they just spare 10 minutes a day, in 6 days, it will be 60 days, 60 minutes, and it is equivalent to 1 hour per week. So I thought that if you manage your times well, we can able to get 10 minutes a day. It is, you can say it is a very minuscule. 10 minutes just go when you go for a friendly talk over the phone. So 10 minutes a day is coming to a 60 minutes a week we can devote. Second, here we are able to connect the peoples who are passionate, and definitely quality. Always the quality is comes from the compassion. If you are a doctor, it is because of being a patient. And if your definition of a good doctor is exist, it is because you are a good listener to the patient. You are working with a compassion. If we are like this, and I hope my friends and colleagues are here, we have a huge task. It is not me working, it is not Odia Samaj is working. It is the face of a profession which has now jumped into a war that will fight. And but for that we need everyone's courage, that we can make it, we can do it, so that the society in a large can appreciate that doctors has come beyond their comfort. Definitely there is no comfort zone now, beyond the limits to help someone. So this is second, I can assure about the sir about the quality, and for this definitely will interact with each others. Third, as rightly suggested by sir Acharya sir, for the educations, that is very much part is needed for the training, for updating knowledges that will help to society larger way. So I request Acharya sir to be with us always. He's a big teacher, great talk mentor, and also tough taskmaster also. So we can get trained by him to work more efficiently. Then fourth is how it is going to help telemedicine in the Indian perspectives. I want to say here that just a person comes to you. This is what I'm saying from the patient perspectives. He has to do nothing. He will just, these flyers will be reached to them. They have to call in these numbers. These numbers are here, which will be with your telemedicine partners. So they will receive these phones, they will receive these messages, and if is anything emergency, they will pass to the control rooms. If it is for any suggestions or want to take appointments, we'll fix it. And for that, the Viveo team will take all this and they will contact these peoples to fit a slide test. Then after this consultation, for consult we just need a smartphone, because if you want to go through the video platform to interact with the doctor, and the platforms like that, at a time we can have 10, 15, 60 doctors also can interact with 60 patients in a single time. After this consultation is over, the patient will get a message link, and then they can get the all detail relevant medical prescriptions too. And this is all through a legal platform. And the Viveo has taken all responsibility for this medical legal actions related to that. Then what we are going to cover, the most important is to the major junk. As you know, as rightly said by Dr. Acharya, and everyone knows also that COVID has a fatality up to 2%, and complicated cases severe is in 10 to 15%. But around 80%, the major junk patients are mild or maybe asymptomatic, and they just need a consultation, which is lacking at this moment because the doctor fraternity is busy, facility is not available, patient not able to contact. So this is where the Odia Samaj COVID Care will give a platform where the major chunk of patients can be addressed for their needs and at an appropriate time for the guiding. Then next important is the wellness. As rightly said, the direct complication, direct consequence of COVID is less, the indirect consequence is more. You can say everyone now, wherever we are sitting, 5 people, we are discussing about the wellness, we are discussing about the COVID, because COVID is in our mind. Even we sleep, when you woke up in the morning, we see first the news or the WhatsApp, what happened to the COVID. So this is has happened. When a patient becomes infected, he may be asymptomatic, but his all things bad comes. Then when someone get isolated, he develops depression, they develop anxieties and psychosis. So these are all we have in mind. So that's why we're having a wellness program. So this program will have a daily direct consultation with prior slots every day from 6 to 8 p.m. through the telemedicine Viveo platform. Then now we have started this wellness program with twice a week, and it will be 8 to 9 Saturday and Wednesday, and you will get very influential persons, motivational persons, teachers, celebrities who are experts in this field to make us motivated to get rid of this COVID related illness or stress by their wisdom of words. And after that, we will have a program well articulated, the experts in the field, not only it will include all the aspects. It may be yoga, nutrition, diet consultations, it can be naturopath, medications, and stress management, all aspects, homeopath, Ayurveda. We are covering around 15 topics every weekly twice to address your wellness. Then I'm not going detail because this will be for the doctors. So all we need to that, we need to, I think we have shared also that just a login, you have to fill this, then we can get the details. And for the sir, I can say, Mr. Sir, so this is a virtual electronic medical record where all the details will be kept in the cloud, so that doctor, whenever he sees the patient, he will see all the reports of the previous consultations, all the reports uploaded by the patient, and also what he has written during the previous one. So hence it is like that he's getting to browse all through to give a suggestions or treatment, not at a single point of time. It is like a longitudinal follow-up of these patients. And finally, he will note down the advice, suggestions, everything. And then this is where the prescription will go with all these legal formalities has been formed. That is the e-prescriptions. Then, as we rightly said, the wellness is one of the major chunk. Most people need it. So we are going to cover all the aspects and for a COVID home care by the COVID Care Odia Samaj. So I just want to say thanks that doctors in a few span of time agreed, volunteered, and till now we have got 100 plus doctors who have volunteered that will be there to provide support at the time of distress to our colleagues, and they have promised that they will give at least 1 hour a week for these philanthropic activities, and the list is going on. I just want to say my colleagues, our doctors, not in only MBBS or allopathy systems, from all fraternities of medical sciences, indigenous medications, wellness practices, all are part of this broader family to address the people in large. And I request also all my friends are here to enroll and make your passionate colleagues who is near to you, who wants to do some form of social service, they can join this platform to make this a big success. So my dear friends, I just request, it is a challenge for us. It is a service to the nation when we needed most, as it always war, and we are also warriors. Let's give a few moments for this cause of the society. Let's join hands make this Odia Samaj and their endeavor for COVID care to the people in a larger interest to reach remotest of remotest to the people's at its distress to bring a smile that will make our all doctors to smile. Thank you.
Many thanks, Dr. Chaudhary, for your words. Yes, the need of the hour is that maybe the time has come that we'll also rope in our doctor friends who are there. The initiative which was started by you and Mr. Mohanty, Prasant Mohanty, the country head of Viveo Health, has the potential to reach out to the nook and crannies of our vast country. And it is heartening to know that many doctors, they have also joined this program today, have volunteered by now. And we are sure that in the days to come, many more would also join. With this, we come to an end of the inauguration program, and I would now request Mr. Hiranya Mohanty, the trustee of Odia Samaj, to give a vote of thanks. Mr. Hiranya Mohanty, please. Bhai, please unmute yourself. Hiranya.
Thank you, Sandeep. Good evening, ladies and gentlemen. Jai Jagannath. First of all, my sincere prayers for the well-being of each one of you and your loved ones in this pandemic situation. A big thank you to the noble intent shaping up with a noble platform that is Odia Samaj COVIDCARE. Thank you, Dr. Ashok Chaudhary and Sri Prasant Mohanty, country head Viveo Healthcare, for making it possible in a philanthropic manner. Dr. Ashok Chaudhary, we salute your passion and love for the Odia community that you have thought of this concept and bring it to Odia Samaj to work on this drive. Thank you so much. Thank you to the doctor friends, already those who have boarded in, for coming forward and joining this platform to render their service voluntarily. And we all know how hard-pressed all the doctors are today in these pandemic situations. A big salute, a big thank you to all the doctor friends, those who have consented and signed up for this platform to work. Thank you to Sri Satyendra Mishra sir for his valuable time and speaking to all of us. It is very encouraging. And sir, we have noted all your points and whatever you have flagged, we have taken note of it. And as assured by Sandeep, we all, along with Dr. Ashok and Mr. Prashant, will address this issue and do justice to the platform being created. Thank you, Dr. Subrat Acharya sir, for sharing your experience and giving a lot of input how to proceed and way forward. We have all taken note of your input, sir, and will implement it as we progress in this particular drive. Thank you, Mr. Tallo, for joining this talk and rollout inauguration of Odia Samaj COVIDCARE. It is really generosity of Viveo Healthcare to extend this technology platform in a very philanthropic manner. Thank you so much for extending this support to the whole mankind who are in crisis at this pandemic situation. Our sincere thank you to all our loved and our mentor and guide, Sri Siddharth Pradhan sir, for advising us, supervising the progress every day as a hard task master. Very diligently, he is monitoring this particular task. And we assure you, sir, under your leadership and guidance, we'll stand up and do justice to the cause we have taken it up. Thank you, Sandeep Mahapatra, for conducting this session. And last but not the least, very sincere thanks to Sri Subhasis Tripathi Bhai and Jyotirekha Das Patnaik, Appa, working behind the scene to make this drive very successful. With this, I take the permission of the chair, sir, to say bye to all the participants today. We'll again meet tomorrow at 8 p.m. for the wellness session. Till then, stay happy, stay safe. Jai Jagannath.
Thank you so much. Thank you.
Love, if we can share the flyer of the wellness program so that if you have the flyer.
Sure, sir.
Yes.
I will share in chat.
Tomorrow, as we have already discussed, the wellness program would be started tomorrow. So anyone can join it and be part of it.
Thank you, Sandeep Babu. Thank you, Siddharth.
Thank you, sir.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank
Thank
you,
you
sir.
so much, sir. Thank you.
Thank you,
Subrata, thank you. Thank you very much.
sir. Thank you. Thank you, Ashok.
My pleasure. My pleasure.
Thank you, sir.
Thank you, Sandeep Babu.
Thank you, sir.
Thank you.